कैंडिड इंटरफेस को स्वागत। आज आमर आलोचनार विषय है फर्टिलिटी केयर। आज आम स्टूडियो रे अछंती श्री राघव प्रसाद पंडा। सी हेले सीईओ एंड को फाउंडर संतान रो। बहुत धन्यवाद मिस्टर पंडा। Since you are associated for a long time with the health sector, what is your feeling like? Because you are associated for a pretty long time in the health sector, and I am sure you must be feeling very elated, happy, and doing a lot of social service. What is your feeling like?
Thank you for having me here. So yeah, you're right. We are associated with health sector for last about 8 years, and we have started creating facilities which are not available hitherto in this part of the country. And our intention is to create latest patient-centric and innovation-led solutions at an affordable price to the Tier 2, Tier 3, Tier 4 cities and towns. And this is a very booming sector because health is wealth, it is called. So when you service the health which is to the underprivileged, to the non-available geographies, you create not only business out of it, but also you create service which is not available. So you create the services which are people get benefited, plus you make business out of it. So it's a both win-win for the
it's a win-win situation from both ends.
Yes.
Now since you are associated with this health sector, how has been your childhood days?
So a normal childhood. I didn't have any exceptional things. But we made whatever friends we made in those childhoods are the friends which are stay for your life. Normally happens with majority of the people. And coincidentally or fortunately, I have my childhood friend with me in Santaan, who is a co-founder. So we both together started this journey 9 years back. So I have fond memories, and we have done great work through last decade in building what we call innovation-led and patient-centric services. And we hope to do well. And this is all based on our friendships in the childhoods what we made. So that's, I've got good memories on.
Right, wonderful. What is your overall scenario pertaining to fertility in India? Because you see in different countries the scenario is different, but what it is in India like?
As per WHO statistics, 1 in 6 couples cannot conceive naturally, so they need a medical intervention which is called infertility. So when you are talking about 15% clinical infertility, that is what you call the numbers. But as you go along,
you mean to say 15% are infertile?
Yes.
Okay. In India?
Yes.
Okay. Fine.
So that's our clinical infertility case. So now with when a country develops into from developing economy to a developed economy where your women workforce increases.
Right.
So then your lifestyle changes, your working culture, and your different what you call your career requirements.
Right.
That add to another additional infertility factor, because you have, when the woman starts joining the workforce, then there will be what you call the delay in marriages, and the delay in marriages leads to you falling into a sector or a stage where you become infertile.
Wonderful.
So that's where your lifestyle and also the joining of workforces, women joining the workforces creates also another additional pressure for infertility.
Wonderful. And what is the scene in Orissa? You say about 15% are infertile in the country. What about Orissa? When we come to Orissa, what is the state here?
It's more or less same, because it's plus or minus 1%, but it's more or less same. And more problem here in Odisha and eastern part of the country is the supply of quality infertility care is not available.
Okay. Okay.
So then what happens is the people travel outside to metros and all, they make
Right.
a lot of much expensive, and the treatment becomes expensive and
Yeah.
unaffordable.
The treatment becomes very exhaustive,
Yeah,
and it's very difficult for people to pay on.
Yes.
I agree with you. Now, what we understand, in such type of system like fertility care and all, there are some legal, framework, obligations. What is that? Because I want that the viewers should know about it also.
I think it's a very good question. This is, recently the government has passed a National ART Registry Act, which has formalized the operating of fertility and surrogacy centers. So there are standards, there are requirements on which you have to maintain a fertility center. So that act has been recently passed, and this is going to create a lot of excellent result for the patients.
Okay.
Because the treatment will be standardized, and there will be transparency which will be brought to the thing. So there will be create a lot of what we call it in our business parlance, I call it formalization of the sector.
Right.
So from single individual, single doctor owned clinics which are good treatment centers, but not formalized kind of sector.
Okay.
So here what we are creating is a formalized kind of sector, and it will create also the kind of transparency which patients are not available now.
Okay. Okay.
So it's both a win-win for the patients and also from the regulator point of view, and this is a very good initiative from the government of India.
So you mean to say it's a welcome initiative from the government?
Absolutely.
And that will definitely go well for the patients too.
Absolutely.
Great. Now I would like to know, when we are talking of infertility, according to you, you think both women and men can be treated for infertility?
Yeah, this there is a basic statistics on this. 40% of infertility are related to female, 40% is related to male, and 20% is both.
Both, yeah.
So there is a misconception that infertility means it's only women.
Yeah.
So it's not like that. The data shows 40% and 40% equally male and female, and 20% is both factors. So it's a combination of both men and female, women. It's not one single individual.
Now another little important thing, which I would like to ask you is, what do you think are the prime reasons for infertility? Though you have spoken something in the initial stage of our discussion, but when we focus, like for example 1, 2, 3, if you just put it in that phase, so what are the prime reasons for infertility?
See, I am not a doctor, but I will try to address this in a layman's language, which we understand, and how do we target our audience and how do we target our customers. It's primarily your, what you call is the clinical infertility 15% will be there. It's like any other disease. It's not a, what people call it. It's not that it is coming just out of the box. It's a 15% will be there. A disease which will be there, prevalent. And second is, as I told you, your lifestyle changes, obesity, your fast food, junk foods, irregular sleeping hours, long hours of working, all those things, lifestyle changes. And also the last part which I briefly touched earlier also, when your career double income no kid, we call it DINK, double income no kid kind of couples. So their career aspiration is higher. So they delay the family planning. Family planning means child, when do you have my child and when should I ready, both emotionally and career wise. So when you delay it, your clock starts ticking. A man and woman are at their peak of fertility in late 20s up to early 30s. After that, obviously the fertility rate comes down both for male and female. So the more you delay, the more you get into complications.
Okay, great. That's very good information. Another one thing which I would like to ask you, as I had just said, you are the co-founder and CEO of Santaan, and you have Santaan in Bhubaneswar and in other places also. And I understand you are also planning to do a couple of units also overseas. Now, please tell us about Santaan.
Yeah, Santaan is a product which has taken birth in Orissa, in Berhampur, to start together in 2015. This is co-founded between me and my friend Dr. Satish Prasad. We were childhood classmates, class 1 to class 10. And that's where we taken step, because we belong to Berhampur, so we started our first center in Berhampur. And 2 years back after, we started in Bhubaneswar. So that's the Santaan, which is bootstrapped. We have created services which is not available hitherto. We are the first center to come on infertility in South Orissa completely. We are the only center, only brand which is having multi-centers in Eastern India. We have been awarded the most awarded centers. We have been doing this business for last 8 years, and we are now going into expansion mode. So we are planning centers in a couple of more centers in Odisha in next 2 years. Also, we are planning one center in Bangalore shortly. So that's where it's a completely bootstrapped. And my partner Dr. Satish is a physician and a scientist who brings in that clinical and innovation things, and I bring in the operations and expansion and building the business. So that's where we collaborate together to create a complementary team to build this business.
Great.
We have bootstrapped it, and we are valuing somewhere around 45 crores now at Santaan, and we've created an employment about 75 people.
Wonderful.
One thing which you have done is, because at the end of the day, technology is the differentiator, because you have same, as you know, that I need not again reinforce, doctors to patient ratio in India is very, very low. So, and doctors cannot be produced overnight, and it's impossible to do that, though government has taken a lot of steps now to increase seats and all those things. But
intake
those
medical colleges.
Yeah, those will come into effect 10 years, 15 years down the line. It will not affect immediately.
Right.
So technology only is a differentiator. That is why we created a Santaan Academy, where we train your doctors and also a critical resource for infertility, which is called embryologist. And I'm happy to share that we have trained about 300 embryologists all over India.
Okay.
And they are placed very well jobs.
Yeah, that's a very encouraging figure.
Yeah, that is how we created the impact on Santaan's point of view from Odisha together. And there, you see, there are in Odisha, you got medical college, you got good hospitals, but there are single specialty, specialized clinics are not available. A couple who is not able to conceive would not like to go to a medical college or a corporate hospital because of taboo. So that's where we created this privacy and transparency related treatments, which has given us good scope.
Dividends, And I'm sure even the couple, they are pretty happy about it, the way you treat them and all, that also is very important.
Absolutely.
Another one little thing, which comes to my mind, and I thought I'll ask you is, say for example, you have started with a very small beginning and you have built up your, setup over here. Now, who has been your inspiration? Like for example, your parents, your teachers, your relations, your friends, who has been your major inspiration to what you are today?
Yeah, it's a very good question actually. As I told you, I have got a good childhood which I have gone through, and my friends in childhood are my business partner now today. So that helps us in both building trust and also building business for a long-term growth. All the teachers which I've gone through, I've gone through from primary to my PG. I think they are my role models more or less, because I've seen each teacher closely and I've learned something from each of them. And I'm grateful to my teachers, because I remember a lot of names, but I don't want to mention one or two names, because everybody has given me something or other from my class 1 to PG. And somebody has taught me humility, somebody has taught me the topics. So that's I will put my teachers as my great role models. And whatever I have been today is because of the teachers.
Yeah, because of the teachers. That's a very important
obviously
thing.
Parents will be there. So
parents of course is always there. Parents are always there in fact. Another one thing which I thought I'll ask you is, you see, when we are talking of infertility, a couple, when they don't have children, and when they, with your support, when they are able to give birth to a child, there is a lot of excitement, elation in the couple. Could you just cite an example, where, a couple has, after they have given birth to a newborn, they have shared their excitement and elation with you?
I think, yeah, that's bringing, our tagline in Santaan is science for smiles. So what we bring in is smiles in the face of the couple. In last so many years, we have seen about 3,500 couples have been, smiling because of their efforts, and also collaborated with Santaan for what they were not able to achieve, they what achieved it.
Wonderful.
And we see that day in, day out, and it is more our doctors who are there, and our staff which are there. So it's their effort and the patient's trust and well wishes of stakeholders which has bring us here. As I told you, the impact is about 3,500 couples have seen pregnancy through us.
And 3,500?
Yes.
Oh, it's a huge number.
Yeah, over. And we are continuously building, striving to bring in more smiles into more couples. So
right.
That's where it is.
Great, great. Now what I see, particularly I'm talking of Orissa, we have a lot this traditional norms, whether we should go to a doctor, they try to adopt some, traditional means to get, pregnant or something of that sort. Don't you think this create inhibitions? This traditional inhibitions is creating a barrier for modern invasion like yours?
Yes, absolutely. This is again, I will tell you, is a very good question. See, the awareness is more important. As we started the business, we knew that it's awareness which is going to create that people are going to trust the technology, the science more than your other things which are non-science, non-proven based kind of things. So that is why we have created a channel for complete awareness. Creating talk shows, creating through media.
Achha, you have done that. You have done that.
So that's where you create awareness. And another second thing which I have also noticed is the more educated the woman is, obviously these things will not get into the couple's mind.
Right.
If a woman is not educated, again you land into the same thing where it's very difficult to convince them and talk to them. We've seen about over last 10 years the women's education also has in our country and this part of the country has already gone to higher levels.
Yeah, right.
So that is where it helps. So
education is also a very important thing,
absolutely.
Because there's a lot of difference between, sure, because I'm sure the response from the villages, rural areas must be comparatively less compared to metros or big cities like Bhubaneswar or elsewhere. Yeah, that's very right. Now another one thing which again I thought of asking you is what are your future plans, expansion plans, and any unfinished agenda you have in mind which you would like to co-create. Could you please tell on that also?
Yeah, absolutely. So now we have done fertility and we are now expanding into, because this model is now set up by us. So we know how to run fertility center in a tier 2, tier 3 city. We call it Bharat. We are a startup Bharat kind of product which we are serving to the rural India through the enabled technology and the training centers which is giving us the power to expand. So we have created the capacity, that the capacity has to be now expanded. So that's one business which are building it now. Second is this is a complete maternity thing which is happening. So you have this after motherhood there will be woman goes through different stages.
Right.
So there are what you call grooming, then you nurture, then you mother, then you become you're taken care of all these needs like cancer screening and all. So that's where building another portfolio called C and hair. So it's more of complement to each other. So we've got cervical, breast, all these things, cancer screening which we are now creating. This is again a highly technology product which is AI enabled, and this is one of its kind which are building. This is a complete disruptive kind of market. Third thing which we are building is S-Kits, which is a pediatric output. So pediatric output is now is what is happening is when you have some problem only you go.
Yeah.
So I have a problem, so I will go to the doctor. So we have created a capacity on called S-Kids, Super and Smart Kids, where the teacher in the school can monitor the health of the children.
Okay.
So you don't need a
both the teacher and
the teacher can monitor the health
of the child.
People.
Yeah.
So you are a class teacher, you are taking care of the education, so you can also monitor. You are a health manager.
Okay.
So these are very advanced devices, non-invasive, which a non-paramedic or non-doctor can operate.
Right.
And in the background, when the algorithm, when the data capturing device captures the data, on the background there is a pediatrician who sees the report and certifies.
Wonderful.
So you are able to screen thousands of children without creating any real hoo-hallas and no need about doctors to come in. So like your English, mathematics or physics you study for one class a day or 2 classes a day. So this could be 1 class per week or maybe 2 classes per week, where you are
you mean to say it should be the part of the curriculum of in the school,
Yes. So
and that will definitely,
yes, so
right.
this is a part of CBSE guidelines also that you need to, because there are a lot of health interventions which are
absolutely needed
for having education output, whether the learning ability is there or not. We have done a lot of screenings here in Orissa. So we found 12 to 15% are not able to see properly.
Right.
So they are not able to see when the teachers ask them something, they are not able to see. They are not able to see that I am not able to see.
Right.
When the teacher tells that this intelligence is not there, but the guy is not able to see.
Absolutely.
15% can't hear properly.
Right.
So if you don't comprehend, how will you reply?
Yeah.
So that's where it is. So that's where we started our first experience center in Bangalore this year. We are starting for.
You have already started this initiative.
Yes, in Bangalore, we have experience center, and Gurgaon also will be starting now.
Okay.
So these are called S-Kids. It's called Healthy Kids and Healthy Nation.
Okay.
If you take care of health of the children, so this is a report card which will come along with your education report card.
Wonderful,
so it's a fantastic thing which you are doing.
Yeah, right. As you have very rightly said, the response to this type of initiative is quite encouraging in the metros, in the cities. Now to build this awareness in the villages and rural areas, do you have something in mind? Because what I personally feel that not only people who are staying in the urban areas should be benefited, even people who are staying in the rural areas should also take advantage of such type of initiative of yours. So in that context, do you have any innovative mindset how to change their way of thinking and be with you so that they feel benefited?
Absolutely. So this is an experiment which started about 5 years back when we did it. Now what I told is, one is associating with the schools and giving the delivery model which is there. Second, we have seen government is very aware of that. Whatever they are targeting, whether through nutrition programs or any other intervention which they are doing on a large scale, they are not able to measure the impact. So through this they can measure the impact and see that whatever interventions are done, they are targeted. So there is a scheme which is there, like Ayushman Bharat is a scheme for healthcare management. There is also a scheme for Vidyarthi Bhavishya Sochana, something like that, which is primarily talks about how to take care about the health of the children in the government schools.
Right.
So because there are midday meals program, there are breakfast programs or whatever they do, nutrition programs, then they have these what you call extracurricular activity programs. So that kind of thing. So this enables them as a kind of impact measurement or intervention, and these interventions also can be targeted. It may not be homogeneous towards across the country or across the state or across the district. So that's where it is. So this is one which is is an innovative kind of thing which you are talking to the public stakeholders and engaging them in our discussion. We have reputed bureaucrats and some renowned what you call doctors who are also part of our advisory board here. And Dr. Satish leads this as a because being a pediatrician, he leads this initiative.
Wonderful.
And then on this basis, we have now launched. We are launching SciScan, which is a state of SciScan.
SciScan. Okay.
S is S, and AI is our artificial intelligence.
Okay.
SAI, SciScan, which is a new age diagnostic center, radiology cum pathology in Tier 2, Tier 3 city.
Okay.
So we are shortly launching our diagnostics.
That will be in Bhubaneswar?
As in Berhampur to start with.
Yeah, you
So
start
we'll-
with Berhampur. Yeah. Okay.
Yeah, so Berhampur will start with now, then we will expand it, and this will be a new generation where we disrupt the complete market, both in terms of transparency to the patient and also the service, the quality of services and instrument which will be there, will be, you know, what you call path breaking kind of
Wonderful.
services.
Great. Another one thing again, you know, what I thought is, you know, since you are very much into this and you are thinking of expanding in this domain, just tell me, do you get the support from government agencies? I am not talking government directly, I am talking of government agencies.
Absolutely, you know, we are a recognized startup from DIPP, Government of India, and Startup Orissa in Government of Orissa. We have been engaging with them, you know, because since we started in Orissa, so we are engaging with both the local and national governments. And we see a lot of proactiveness in government in last from we
they
started.
also evince lot of interest in this.
Absolutely.
And they also have been a motivating factor in your initiatives.
Absolutely.
Very good. Now, since we are coming at the fag end of our discussion, I would be extremely happy if you would give an inspirational message to our esteemed channel viewers.
I know that is the India which we are living now is full of opportunities, and we must be seeing, at least in our generation when we were studying 15 years, 20 years back, entrepreneurship was not a word or not a career. But now when I see this, you know, India has a lot of problems to solve.
Right.
And I see huge amount of optimism in our youth, which are coming out of the colleges.
Wonderful. Wonderful.
Coming out of these engineering colleges, medical colleges. And when engineering and medical work together, then you see wonders can happen.
Wonderful.
So I see very,
That's
very
great. That's great.
bright future for India, and the guys which are there coming.
We have to
they are
take
much,
full advantage of that.
Yeah, much smarter than us. So
Absolutely.
I think they can build in.
Thank you so much, Mr. Panda, for being with us. दर्शक बंधु आपण माने मध्य निश्चित भाव बहुत एंजॉय करथिबा हमर डिस्कशन. धन्यवाद.